This week on the Evolve to Perform podcast, we discuss a modality that is commonly used in healing, ice.
While we know that ice might make you physically feel better, it may not be the best tool to use.
We discussed where the idea to use ice originated,
Why using ice might not be the best idea,
the science behind healing,
and other things to use to help you get back to your active lifestyle. So save your ice for your drinks and let's get started.
Welcome back, everybody, to the Evolve to Perform podcast. How you doing today, Kingsley?
Pretty good, Jordan. How are you doing?
I'm doing okay. Before we started recording, I was just talking to my friend, and she said that she twisted her ankle. So maybe we could talk about something with the ankle today. And I told her to put some ice on it. So if there's anything else that you gotta work with me here. You gotta act shocked when I say ice. You gotta go.
Yeah, sure.
So I was talking to my friend before this, and she said that she twisted her ankle. So maybe we can go over something with ankle strength stuff.
Sure.
But I told her to put some ice on it.
What?
Yeah, I told her to put ice on it.
Ice?
What's wrong with ice?
Well,
rice. Rest, ice, compression, elevation. No?
So that's back to maybe the approach to 1980.
I wasn't even born then.
I was.
Okay. So
Yeah.
I shouldn't have told her about ice on her ankle?
Yeah, I think, probably not.
Oh.
But that's okay. That's all
Okay,
right. So,
okay.
but we can dive into that today especially.
All right, so I guess we're talking about ice.
Yes.
We're talking about ice.
All right. So first of all,
Yes, we're talking about ice. That was the plan all along.
Gotcha.
Gotcha.
yeah. So we're going to talk about ice. We're going to talk about why we here don't prescribe ice, even with any type of.
I like how you said that. Your prescription, one day of ice.
Right, exactly. Very brief, if anything. But yes, we're going to talk about why we don't prescribe ice for injuries, not just ankles, but it's any type of acute injury that happens. So we have people coming off of surgery, sprained an ankle, sprained a finger, anything like that. We say no ice.
So where did this even start, this whole notion of if you hurt something, put ice on it, especially if it's swelling?
Well, I think it started from what I've been told or what I've researched and read on is that it took, it started, years back. We're talking about over 50 years ago, where, there was an instance where there was somebody who had lost a limb in an accident.
Okay.
And they were, when he got the first aid treatment and things like that, they were able to preserve his limb, reattach his limb, and they really credited actually that he had his limb in ice.
Oh.
Okay, so there was a story back in the day. So there was a young child who had his arm severed, and so when he got his first aid treatment, they rushed him to the hospital. They were able to surgically reattach the arm because the tissue wasn't damaged. And that's why it was credited that the fact that they had put the arm in ice before the surgical reattachment and things like that. So then that's why it became something as as a commonplace treatment to say, hey, look, if you have an injury, if you have something that happens, ice it, because what do we initially think about ice? Is that it gets rid of swelling. Yeah. Right? We want to get rid of that's what we talk about, anti-inflammatories. All the initial treatments are how do we get rid of swelling? We're taught that swelling is the enemy, and it is the enemy. However, we find out now that there are better options on how to reduce swelling without delaying healing.
So you're saying ice delays healing?
Yeah, it's been shown now that ice delays the healing process. It delays the synthesis of proteins. Right, proteins are muscle tissue. That's what our bodies are built off. Those are the building blocks, the foundations of us to build muscle and also heal. So we're finding out that ice is actually delaying that. So why would someone want to do that?
Yeah.
In the event of an injury.
So this actually makes so much sense because you're saying that with ice, it stops the healing. Of course it does. It pushes pause
Yeah.
on living things, apparently.
Yeah, it does. It does.
Like Captain America.
Exactly. Right. How long was he in ice for? 70 years? I don't know.
I don't know.
All right. Well, either way, right? So we'll find that out anyway.
Yeah.
But so yeah, it puts basically yes, it's a pause on cell response, and so that's why like ice is good like in things like limb like a limb getting cut off, or even like the first line of treatment for like a spinal cord injury. You know, so you'll hear now, you know, you've seen now that like spinal cord injuries, you know, they'll put those spinal cord patients like immediately like they'll like circulate ice water, they'll cool their body down, bring the body temperature down so that it just decreases the amount of damage that takes place.
Okay.
You know, and that's like puts them in a better place to, you know, not have enough have permanent nerve damage, permanent cell damage. And that's why you would use ice. But for us, we're talking about trying to regenerate or trying to speed up the healing process. So why would you put ice, you know, on an injured body part? Yeah, does it help with pain? Of course it does, because that's what shuts down the nerve impulses. It slows things down too. So that's why we don't have that pain. But in the long run, what we're doing is we're still putting pause on the healing process. What we need to understand is that inflammation is actually a positive thing. Inflammation is what you need to start the healing process. So why are we going to continue to put a fire extinguisher on inflammation when we know that's what needs, you know, is needed for it to start the healing response altogether?
Okay. Why is inflammation good? Like, why would you want inflammation?
Because it starts the whole process of like cellular activity where we need to send like the cells which are responsible to clean up an injury site. You know, it's our signal to our body that, hey, we need to send like a rescue crew to clean up all the stuff. You know, it's like a car accident on the highway. Okay. So all right, so there's a collision. The EMTs have to get there, police, whoever it is, have to come and rescue and clean up the accident. And so why are we going to go? So ice, what that does is we know that it vasoconstricts. You know, and it vasoconstricts in a way that, you know, one, it's going to more so. It's not going to actually like create more of like a traffic jam of getting to the injury site or to the accident. But it's actually what we have to do to be able to clear the accident site. So if we ice our body, we can't get all of now the fresh things like fresh blood, you know, all that circulation to now heal the tissue. So we've cleaned up the injury, we've had the rescue team come, but now we are actually creating a bottleneck. Like we can't get that rescue team to leave and move on, and that's kind of like should represent like our healing tissue.
Why do you think that people still go to RICE, which again is rest, ice, compression, elevation, and why do you think people are still like kind of holding that to the gold standard?
I think it's just like an old myth that has to be debunked. I mean, you know, we're so tied to traditional information, you know, that is like traditional medicine, you know, medicine and medical advice that we'll get. So, you know, it's hard for us to change our thoughts when we've been programmed for so long.
Yeah.
That this is the way that things are done.
Yeah. And what do you think are the biggest misconceptions, besides the ones that we've already kind of discussed, that athletes and patients have about using ice?
We're looking to get out of pain, and I totally understand. So when you're injured, yeah, of course it sucks. You want to get out of pain, so the ice can numb it. Okay, and initially, when you after you ice something, okay, yeah, it looks like the swelling goes away. You know, and yes, it does.
Oh, okay, I was gonna say, does it not?
Yeah, it does. But even if you keep ice on for too long, you know, so ice initially will constrict everything, will tighten everything up. But if you keep ice on for too long anyway, there's a reflex in our body that will actually dilate everything anyway. So it's like it will constrict for a little while, and that's why the swelling kind of looks like it decreases. Keep it on for too long, then things will blow up back up again. But then again, because we've iced things, we've created such a cold environment, and there's less cell activity, we've created a pause. You know, and now we actually need to be able to we need to open things up and get, again, that cleanup crew, clean it up, and let that cleanup crew exit, recirculate back into our body and clean things up. And so we're talking about things like the lymphatic system, right? We're actually slowing and shunting our lymphatic system when our lymphatic system is our body's sewage-like system, basically. Clears out all the junk.
Got it.
Right, clears out all the garbage. You know, so you'll hear people say, like, it's really important here that when we're trying to heal an injury or get over some muscle soreness or pain and things like that, we want to be able to do things that help us, you know, clear the garbage out and bring the groceries in.
Okay.
All right, so that's where I'm going to be quoting Kelly Starrett. He talks about that because we're talking about.
You mean Kelly Starrett of The Ready State?
Of course, he's the man. So, you know, so yes, so we want to be able to clear out that garbage, bring the groceries in, and that's really just saying, what are the best things that we can do to improve circulation with less interruption, less blockage, less impedance?
Got it.
Okay, and ice slows everything down.
Got it. So I'm sure the question on everyone's mind now is, if not ice, then what?
We got peace and love. Is that what you're talking about?
Well, no, I'm just saying, like, if
Yeah.
I hurt myself and I sprain my ankle or I bump my head or I hurt my finger and I want to help the swelling, what do I do? Do I just stare at it and be like, no ice, no ice, no ice?
No.
He said don't use ice.
Of course not. Of course not. You don't have to be like, you know, a martyr. Is that a martyr? Or a masochist or whatever it is, and just like suffer through pain.
Don't fall on your sword.
Right. Of course, we don't want you to have to suffer.
Yeah.
So other ways are like, you know, of course, after an injury, okay, no broken bones, you know, no other like structural damage in that degree. So now what I can start to do to get this fluid and stuff to move and shift, and so taking the garbage out, bringing the groceries in, is, you know, do I apply some compression, intermittent compression on the injured site?
Okay.
It's more about getting some sort of mechanical input to clear the area. So if you have compression, if you have like a body worker that you really trust, a massage therapist, lymphatic drainage specialist, who are gifted with their hands, you know, who are gentle enough but still strong enough and skilled enough to really just help you flush the area.
So if you have like a sprained ankle and it's swollen, or like an ankle injury and it's swollen, you're saying you could go to a lymphatic. Wait, you're saying you can go to a person that has knowledge in lymphatic drainage and they can like work on the ankle for you?
Yeah, I would say a lymphatic drainage specialist, any skilled body worker.
Yeah.
Right, these are healers, right? They heal with their hands, they heal with their intuition. You know, who can physically
Getting a little witchy over here.
You know, but just I believe that there's really like these gifted healers, you know, who have like this intuitive sense on how to help you. So it's like, you know, but you get that physical touch, you know, to mechanically move things. And so if you can start like on the site, but if you're overly sensitive, there's also other areas in your body. Our bodies are a network of channels and connections. So even if we work in some other areas like above the injury site that help promote the drainage and circulation, those are certainly things that we can do. So it's compression, it's having someone that you really trust who are like gifted with their hands, you know, just to get that mechanical movement.
Yeah.
You know? Or on top of that too, like once you start to do that, you know, then you start to feel more comfortable, you feel safer in your environment where you can actually start to move. So this is where the movement, our own movement itself, continues to help with that, because those movements are creating muscle contractions that now are allowing us to just like, you know, for lack of a better term, like squish out that extra garbage that has to heal back up into our lymphatics, you know, just to drain our lymphatic system. And then we get fresher blood back into it. So the fresher, you know, we get blood back in, and we know that blood's healing, restorative. So the more that we can do that and more often and as early as we can, that's how we're going to heal and heal without the use of ice.
Got it. Dang, you talk a lot. No, just kidding.
That's my problem.
No. That was my favorite thing that I said to you like a couple weeks ago. And it's so funny. Because you were like, and I'm like, no, you're supposed to. I'm totally kidding. Okay. So is there anything that, besides the spinal cord example that you gave, is there anything that would be beneficial to use ice? Or no, nothing?
Well, I mean, if you're talking about, I guess like if you're not sure, how severe an injury is, okay, then I guess you could use ice. And I'm not saying, and I say this in a way, I'm not saying that you don't use ice. If you're in pain and you don't have anything else to help you take the bite out of what you're feeling, use ice. Maybe the first day, maybe the second day. But we can't get married to the fact that we need ice to control our pain.
Yeah.
I'll kind of like, backtrack or swipe left a little bit here just to kind of go back into into what we're talking about
Swipe
here.
left?
I don't know. I just try to keep up with the lingo.
It's like a dating app thing.
Well, I'm just trying to say, like, let's scrub back a little bit, right? Let's just take it back.
You just X'd someone.
Oh, is that what it is?
Yeah, swipe left.
All right, next time I'll do that.
You just swiped left on ice.
Did I? All right, well.
Swipe right on compression.
Yeah, there we go. But what we're saying here is like, a lot, most of the times when you have the pain, the pain is, yes, definitely, it's coming from like the swelling that crowds all the spaces that you have for all your soft tissue and everything else. So that pressure, and our body has these pressure receptors in it. So when we fill up something with fluid, it's all that pressure on top of each other, layer upon layer, that's what causes the pain. That's why we want to make sure that we're trying to, just kind of free that up as much as possible, because that's the thing that causes the pain. So ice can numb you up for a little bit, that's fine, but mechanically, again, let's just make things less crowded, right? If you're in a tight space and you feel, if you're in a room and you fill it with more people, that's what ends up happening, right? You can't move, and you fill it with more people and more people, forget it, because all of that stuff just continues to build up, and that's why we have that pain. So we've got to just clear that room of people and allow everyone to kind of move and dance and kind of move freely without bumping into each other. That's kind of what we're looking for, just to restore that within that injured site.
Got it. And why do you think the medical and sports community has been so kind of slow to say no to ice?
I think, again, it's just going back to like traditional thoughts and beliefs, but I think we're doing a better job now of informing people that's not like the immediate like treatment or things that you put on for an injury. So I think we're doing a better job.
Okay.
Yeah.
What would you say to an athlete or an everyday person that insists that ice is the only thing that helps? Because when I was in college recently, the basketball players would walk around with ice, like bags of ice saran wrapped on their knees.
Yeah.
So someone that's like used to that, what would you say to them?
I mean, you just simply ask them like, hey, do you want to find something else that's going to help you recover sooner, feel fresher sooner, be more comfortable sooner? And I think that would be a yes, yes, and yes.
Some people are stubborn, you never know.
That's for sure. And I guess, and that's what I want to say too, is like, let's encourage everybody. Like, you don't know until you try it.
Yeah.
Right? So don't dismiss anything. I think you have to be more open-minded. I was guilty of that, being that athletic trainer also.
You were stubborn?
Still stubborn.
Oh, that's so funny.
Yeah, so I was guilty of being that athletic trainer years ago too. That would wrap up the athletes with saran wrap in an ice bag.
I was always kind of like, I kind of want that.
It looks cool.
It looks cool.
It looks totally cool.
Yeah.
For sure. But I think over the course, so what I like to think of is that over the course of my years and experience, I've learned a thing or two.
Yeah.
If it's just one thing,
Yeah.
at least I know it's like we don't ice. Yeah. And it's like to also give you guys like a little bit of information about other things that you can do. If we talk about this, like one of the pieces of equipment that we like to use initially
if we clear out and making sure that there isn't any like bone fracture, bone damage, and other things which are more serious, we use compression. So we use the voodoo band as one option for compression. We also like to use stim devices like the Marc Pro.
Wait, did you say Marc Pro?
Yeah, we have a code for that.
We do?
Yeah.
Or the H-wave, because those are things that are basically like creating like these isolated muscle contractions that we don't have to voluntarily do to help us clear out any type of injured site. So there's other options here in terms of having to find a body worker, having to come to a PT. But of course, like if you're not sure, just find like your local PT or someone that you really trust with, just musculoskeletal injuries and things like that. But we also will link a bunch of stuff right in the show notes.
Yeah.
So you guys have some resources, and we'll also like share like a book too. If you're not convinced yet that ice is not the solution, we'll link we'll link a book that you can look up, or if you even want to come in and talk to us about it, I'm open to talking to you about it.
E2P Book Club.
That's right.
E2PP Book Club.
E2PP.
That's what I call it on the
I see that. Yeah.
Yeah. On the computer.
Yeah.
Well, where can they find you? Thank you so much for joining us today on our talk about ice. Any last words?
No, just do the right thing.
Did you sound like a dad?
Really?
Well, you are a dad. Yeah. Hey, do the right thing. Make good choices. Guys, we will see you next time. Have a great week, and don't use ice unless it's in a drink.
Be good.